events from June to August. In June 2020, we started the program with unlocking the lockdown, and therefore we have an opportunity of for about 5 important people on various disciplines, starting from the infectious disease specialist to the digital technology and pharmaceutical people in that. And in July last month, we did a series of unlocking the stress. And here we are fortunate to have with us Anaji, the leader, one of the famous men from South India, from Kanyakumari. He is in charge of the Vivekananda Ashram. And one psychologist who gave a talk on the unlocking the stress. Now today I'm very fortunate. This is a very important event where the topic is unlocking the practice. And who else can give a better opinion regarding the unlocking the practice during this COVID pandemic? These are the really the 5 leaders who will give us an insight of that. So unlocking the practice for the last 5 months, starting from the March onwards, there are various factors for the practice which has modified the practice. Initially, when they started with the lockdown period, most of the doctors, they stayed at home and neglected, and then we realized that there are a lot of non-COVID mortality and morbidity, and that's a very important factor, and as a professional we cannot escape, and particularly for obstetric practitioners this is absolutely impossible. So the physician factor are there in consultation. There are a lot of opportunities, they're where to go and how to have a consultation, how to do a surgery and all that. They're afraid of that, particularly on contamination. Second important on the health authority, sealing the hospitals, another factor for that. And these are some of the physician factor. The patient factor is also there because there is a lockdown, shutdown, and everybody has busy in physician factor, and in the patient factor, they are not able to come and see. An emergency also, whenever they come, they face a lot of problem. And till today also there is a problem of coming because of the fear factor is one aspect, and because of communication, because of the other personal and social factors, they are not able to come. Then third is the press factor, the media. They are having a lot of, I think every day, the corona meter up and down and all that. No, nothing is down, but up, always up and all, and features of all the evidences throughout the states, throughout the different country and the globe, they project it, and that gives that's a additional factor for the practice. And of course, the policy guidelines, policymakers guidelines, the different strategies, because we do not know, every time there is a change in the strategy of the government, state government as well as central government, like lockdown, shutdown, the shutdown, weekend lockdown, different containment zones and other things for that also. And this is also influencing our practice also for that. And last but not the least, the corona pandemic is less than what is called a phobic or a fear pandemic. Fear pandemic amongst everybody has really confused us in that. So these are the factors in unlocking practice for that. So as a gynecologist, as a forum in gynecologist and the audience of obstetricians and gynecologists, these are the key issues. Consultation, real need, how we can do a consultation, protecting ourselves and seeing the patients and giving a benefit of it. Your own consulting chamber, the hospital, maybe a small hospital, nursing homes, where the social distancing is not possible, how to do it with that, public hospitals, corporate hospitals. Yes, the setup is completely different for that also. And one of the important, I say that obstetricians and gynecologists, sonography is a part and parcel of all obstetric practice and gynecological practice. I always say sonography is the right hand of the obstetricians and endoscopy is the left hand of the gynecologist for that. So without sonography and without endoscopy, nobody is designated as a complete obstetricians and gynecologists. So sonography also, I've seen a lot of precautions how has to be taken for that. Then surgery. Once upon a time, there was a guideline that elective surgery should be postponed and only emergency has to be taken. And we are fortunate as well as unfortunate that emergency are more common in our profession and as an obstetricians, and therefore we cannot avoid this particular case because of our professional thing. And of course, lot of and create a revolve around endoscopic procedures, and as an endoscopic procedures also, what are the precautions we must take? There are There are the pinnacle of endoscopist who is present here, Prakash, will enumerate everything for that. Then the obstetric practice. I say that obstetricians, we cannot, from the beginning till date, the obstetric practice, we are not known what are the impact on the fetus, on the delivery and all that, what are the normal delivery, what are the protocol, what are the emergency procedures we have to do it and all that, what precautions we must take it, is that a separate hospital or in the same hospital in the different isolation ward, that is again a concern for us. And of course, infertility practice. Initially, it was absolutely a deadlock in infertility practice. I hope during the last recent months, they have started again a momentum for that. But still, there is a problem of infertility practice. It has not gone to the full expectation for that. Oncology practice, of course, it is also an emergency like obstetric practice, and we cannot have this particular case. Now, something called telemedicine. Everybody, they are telling that, yes, the government is also propagating telemedicine, WhatsApp medicine and all that. But in a chronic care, is absolutely dependable for that, but follow-up. But in our cases, in acute segment and particularly for emergencies, we cannot completely rely on that. But definitely, it has a scope for that. And that is the thing which we can discuss in future. After the epidemic will go, I think the future of what will be the scenario of corona or any such infectious disease and pandemic in future, we have to highlight for that also. And therefore, with these key issues, let us listen to the leaders, and I welcome all these leaders who have immense experience on practice of obstetrics and gynecology in general, as well as on a particular aspect focusing on infertility or endoscopy or sonography or something like that. And therefore, I welcome all five, my whole past president of FOGSI, and to give their own opinion and experience on that, and that will really benefit our viewers, the youngsters, for to go ahead with that. I think their inputs will be really invaluable inputs for all time to come, a memorable event, and people will be convinced that this is a thing which is not an ordinary webinar. It's a really a message we given to us in a practical sense. Welcome Dr. Dehma Divakar, Narendra Malhotra, Reshma Dilampai, Nandita Palsetkar, and Prakash Trivedi. I think with this five, let me start own opinion, each individual person's own perspective on all that, and have a debate, have a conversation with that, so that people will be benefited for that. Then after, we will have the SILD Healthcare has requested me to invite, particularly all five will inaugurate their SILD e-Connect services for that, for educational program for that. I don't know the details of that. They will explain that, and we'll just inaugurate. And after that, of course, we will have an opinion from our viewers, any opinion and all that. It's not an answer to the galaxy of audience, galaxy of speakers like this. It's just an opinion and their own viewpoints for that. If at all, we'll take some time on that. And then goodbye, and then end this session with that. With these few words, I again welcome everybody. I welcome everybody, all of you, the giants and leaders of FOGSI. And to start with, I will just welcome Hema. I think Hema Divakar, Past President of FOGSI. And to anybody, she is really an insignia of innovation to implementation. I know Hema, and I remember in 2009, our personal relationship, I must tell this time, that when going for a FOGSI, President told that both of us talk together, and Hema told that no, he told that no, man first and all that. And he told that you go first and then I'll go. Hema for that event. And you are the real leaders. You are a woman of ideas and innovation to implementation and all that. Let's hear from you. What is your personal experience for that also? We don't believe in theory from the data and other things for that. Your own personal thoughts, that's more important than any evidence of literatures for that. Welcome Hema to start with, and just tell of your own experience since last 5 months and future regarding the practice scenario and what is that. Yes, well, Hema.
Namaskar. Whilst I am called H-E-Y-M-A-A, Hema, PC is called Mahan of the organization. Always you will remain so for us, PC. About the personal experiences. Yes, it was around the time of AICOG Lucknow itself. Few of our international faculties started raising a buzz. Can you organize a video conferencing kind of a facility into the AICOG? Because our travel advisory says don't travel out because of the COVID pandemic. It's the first time ever we heard of that and a little confused. Is it really, is that, why they are fussing so much and all of that? Slowly, in another 6 to 8 weeks, we recognize that it has come and it is here to stay. And unless we adapt and divert our mind, find our way around how to combat this, still continue to have the good senses to make good practice prevail, it is indeed a challenge. Not that we haven't faced any challenge ever before. We have the mindset that this too shall pass and we will find our way around. So one of the first things that we did was way back around 25, 28 years back, when the HIV came in, we were the only private center in the whole of South India who would take the HIV cases for delivery. So the whole process of getting the staff together, counseling them, making them know the protocols, making them fall in line to understand and to be caring, compassionate, and not have a stigma. It started way back then. And the same, some of those staffs have also remained with us even today. So one of the first things we did was to put up a staff meeting, right from front desk, security, everybody, to make everybody be on the same page so that they don't panic. Their confidence levels are scaled. And we also brought to their notice what they must follow and why. And it's not just we turn our backs and they do their own things. They completely correctly understood what it was. The second thing we did was questionnaire, TOCC, that is travel, occupation, contact. That was, in the forum. We used to send a WhatsApp message with a Google form to all our patients. They have to fill that up even before they come to the center. And the triaging is done accordingly and the patient systematically segregated. So things started rolling in pretty much in keeping with what was expected with the protocols. And we thought we should not keep this to ourselves. Let's spread this training around the entire state. And the Karnataka OBGYN Society came together. Every single day we ran 2 batches of the teams of various hospitals. Half of them who had panicked run away from the from their jobs for me to come back. And the entire training course for the whole of Karnataka we saturated, and maternal and child health care in a way we put it on track, because everything can stop, but not the childbirth process. So this was our startup thing about always the concept of, yes, the situation may be good or bad. In any given situation, what is it that we can do? What more can we do? With that attitude, I think it always makes one feel better and stronger and more confident and contributory. And that was how we set our way forward in this backdrop of corona pandemic.
Well, Hema, I think this is a very valid point you have started beginning of this initial period and all that. While screening the patients, you ask about the travel history, your contact and your symptoms and all that. And those who are having symptoms, you don't entertain and refer to somebody else?
We had a separate entrance.
Or have you isolation ward?
Like a free fever clinic and a triaging done there. And then, at that point in time, we had the ambulance number and we had to send it to the government center to have them checked and then the follow-up. In the meanwhile, since I'm hugely, hooked onto the digital platform, since last 3 years, we already had a video consultations for a report review, because that was, So patients coming from far and wide, once they come in person, and then they have to only come and see me back for the report. So that system was already on. After this March 25th teleconsult mandate came along, and it was legalized, and we enhanced the same thing to connect with all our patients. We had the database, they also had our app and everything. In that way, it was seamless, because we just drifted into enhanced series of video consultations, both for myself and my associate consultants, and as per the protocols, far and few in between their visits for the low risk patients and high risk as mandated. So we had to do a lot of in-house brainstorming of how we would set our systems right. Okay, and then every day the advisory was changing. So every day one of the key members in our group had to read about it to tell everybody that, hey, this is what we are supposed to do. And then when the advisory came for testing every woman at 36 weeks or beyond, and when she presents in labor, that was a new thing. Then asymptomatic COVID positive cases. So the all mix up and mash up was happening in the head. But by the time we crystallized and got it into practice, it was pretty much everybody was clear about what is the way forward. That's how
in your hospital, do you document and have a signature in the forms for legal purpose about the details of that from the patient? Unless the form duly filled them, you don't entertain that?
No. See, as per, we are taking universal precautions, which means that whether known COVID positive or not, everybody has to, the distancing, the masking, the hand washing, the whatever, the national use of PPE, etc., everything is going on.
In consultation also, you are using the PPE?
Pardon me?
In consultation also, you are using the PPE?
No, that is the rational use of PPE, what we call. The impermeable gown has to definitely be on, and the mask and the goggles, the cap, and
suppose you have a big setup, but a small clinic. How they will maintain the social distancing? Give your opinion on that.
See, the minimal, they can definitely wear a impermeable, that raincoat type of a gown for sure, and mask and goggles is not an issue. They have to wear the gloves, and they have to distance themselves, because only not the relative also we are not allowing into the consulting. So that distance, sometimes the consulting chambers are also small, I agree, but as much distancing, that is why I find personally the video consult to be really a blessing, because without the mask comfortably you can speak to the patient, and then the dialoguing and the thinking process is far different than trying to keep her at a distance there as well. So that is how, smaller units, yes, they have to figure out which is the consulting room. They may also go and sit now, which is a long corridor type of a space, because that distancing is one of the key things to be done for sure.
Last question. At the present setup, I think when the tests have been there, universal test and tests have been, rapid tests are there, antigen tests are there, available within minutes or within hours, it can be, a report can be obtained. Do you recommend, what is your protocol? Do you recommend that this test should be done routinely before surgery or before delivery?
As of now, we have quite clearly understood facts. One is, if we go as per the ICMR and Government of India guidelines, then only closer to the delivery dates and at delivery, her status should be known. That's the only thing that they mandate. But we, on counseling, if the patient is convinced that yes, before undergoing a surgery, if she knows her status, it is better for her, this is better for us. So in that sense, we tell her and get the test done. But rapid antigen test, if it's negative, then she'll have to go for an RT-PCR, and that time lag is there. As I said, it's always wise for each one of us to do the universal precautions, because even if it's negative, the false negatives, the incubation period being negative, and in the relapse phase there are so many issues around that. So we cannot definitely say that just because you have done a test, you have a false sense of complacency and try to let loose and do anything that you want. Even in the wards, even every of the housekeeping staff and the staff nurses, for the breastfeeding issues and other things, the medication, etc., they have to be at the distance. And home monitoring is another thing that we have instituted with the Health Arch, is the new app that we've launched. So with that, the postpartum care is entirely on the teleconsult. So
in Karnataka,
we've done the best we can, but we are still learning.
At all levels, one is trying hard to implement this, starting from the policymakers to the professionals like us. Because
and
I know
also
that
documenting the data largely. We've had 3 international publications already on the COVID issue, because our battle is for universal testing throughout the antenatal period, so that we can document and we can know other implications of being COVID positive in her entire pregnancy. We don't know whether it's actually leading to abortions or whether it's actually leading to DIC or growth restriction or what the hell is happening. But unless we have the data, we may not. And contact tracing from these asymptomatic pregnant women diverges, and then it cascades into cluster being tested. So some sorts of capacity building or monitoring these patients, either at home or in isolation or in quarantine or in the hospital. There's so many things that one could and should do. So we are on the track, running the race as fast as we could.
And Karnataka government, as I know, that they have met all civil hospitals, COVID hospitals and all that, and full-fledged COVID hospitals.
And the university has tied up with us for all these capacity
What
building
about the
initiatives.
private hospital? What about the private hospital? They're also involved in that public-private partnership?
Yes, the private hospitals also, the large private hospitals who can treat COVID patients, percentage of beds depending on the capacity. There's a complete list of what we have shared, the Private Hospital Association. So if out of 100 beds, 50 are to be dedicated to COVID, that's in a separate wing, but in a private hospital. So that's totally been mapped out, and there's an app as well for it is working all right. Also,
what about our gynecologists in Karnataka? Whether they're refraining from the services, or they are not afraid of that, and whole are doing right from the day.
I think the Karnataka Connect has been pretty strong from the time that we've also started the COVID preparedness program, because we started it well ahead of anybody else, and then the program ran for 24 days. But even after that, once in 2 weeks, all the presidents and secretary Pan Karnataka come on the Zoom and then exchange some lessons learned in the 2 weeks, and see how we can set our way forward and what help we need from each other. May it be PPE kits, may it be some protocols which are revised, may it be about HCQ being taken for the healthcare providers, may it be the transfers and some newer antiviral drugs, what to do, what not to do. Even the lot of sharing is happening, which is most welcome, because it is challenging, it is confusing, because every day one person says from WhatsApp something else, and so this kind of face-to-face brainstorming is helping a lot to actually get the evidence on the table and see what best we should be doing with each other.
And Hema, I know that I think you are best in prediction. Can you predict that when Corona will be out from India? Because I know that you are now the advisor of Guru Sri Sri. Once upon a time, Sri was a guru of yours. Now I came to know that he is following you. And he has become a disciple of him.
This was coming. I knew if PC is there, he has to pull my leg.
So prediction. It's not a prediction. I think basing on scientific thing. When it will be normal. So that our FOGSI will be normal, our AICOG will be normal, or everything will be normal.
No, I think the best mindset would be to take it along as we move forward.
Because, so don't be afraid of that. Don't be panicky about that.
Yeah, because to wait for anything in our life, on this journey of life, that this day this will happen and then things will change, is not the right philosophy ever. Just go along, because things may become better, things may become worse, but you have to adapt and you have to be and do your best in whatever circumstances. So that's the mindset we always have to work with, COVID or no COVID.
Thank you, Homa, for your beautiful experiences and really a practical tips on that, particularly on the COVID pandemic and the practice, with special reference to the practice. Thank you, Emma.
Thank you, Maha.
Now, the second, I think I will invite Dr. Narendra Malhotra, our handsome personality, past president and president of the president also, Dr. Narendra Malhotra, to come forward and have their views for that. And he is really a person which I can recollect during my old days, long back in 80s. Narendra, you remember that when Dr. late Palaniappan was doing a conference in Chennai, Computer for Doctors was written by 25 or 26 years old boy, or less than 30, I think Narendra was there. At that time, we formed a young talk in that Chennai convention center, particularly. That convention center was not there, the ICOG main venue was there. So till that time, Narendra was very active in FOGSI on various aspects, only for gynecology and obstetrics. He is an extraordinary common sense and a wit, and that's why I thought I will learn from you, and people will learn from you what are the tips and tricks of practice today. Narendra, please welcome Narendra and give your own views on this particular expert. So listen to the leaders, Narendra.
So thank you, Dr. PC. Thank you for taking me back to 1990. Sirish Sheth released that book of mine, Computers and OBGYN. I'm doing the second.
Computer, nobody knew computer. You are the first person to start write a book on computer.
And if you have that book, the first page showed a picture of the president sitting in FOGSI office and the virtual managing committee. So there's a picture of the virtual managing committee.
That's why I just recollect that.
We actually had that this year. So I'm revising that book. The second edition will be out because a lot of telemedicine is being taught. So for me, COVID, of course, I heard in AICOG, and that's where we thought it's these crazy Chinese who are eating wild animals and spreading diseases among themselves. We never thought it is going to cross borders, and we never thought it will come to India. The Chinese go for their holiday, Chinese New Year, to Italy, to Spain, to USA, so they'll spread it there. So we were very happy, but we never thought the Indians living in Italy, Spain, and USA will panic and come back to India and bring this disease to India. So this came, and a very, very difficult, challenging time of 6 to 8 March, the ISAR conference. And we were into huge pressure of cancelling that conference, and of cancelling and not, because it takes about 3,000. And if you go to the Facebook post, there were so many of people who bombasted, cancel it, you're putting life at risk. But that conference luckily went off very well without a single guy getting infected, except for Mettler got held back in India for 2 months, Professor Mettler, and the group from Egypt got held back in Bombay for 7 days because Modi ji cancelled all the international flights. So for me, 13th March, the lockdown day declaration was a major, major change in life period. 400 small obstetric units in Agra closed down that day. And we being a super specialty, bigger, even my smaller nursing home, I had to close down because everybody ran away. The staff ran away, the doctors ran away, everybody just disappeared the next day. And because I was running a super specialty hospital, which was dealing with trauma, dealing with cardiac, and dealing with high-risk obstetrics. So I had no choice but to work. And we were 1/4 of the staff in March. And that is when the district magistrate authorities and all, they came to my hospital at midnight. They said, we have to discuss something urgently. So we discussed, and they said, you have 3-4 blocks. Why don't we do something about COVID block and all? I said, see, I am dealing with cardiac, neurosurgery, accidents. If I have COVID inside, then these guys will suffer. The non-COVID patients will suffer. So we opted out of COVID and we continued with non-COVID till date. And we made, because we had 3 buildings, so we had one building as a triage building with a green, red, and orange blocks. So any patient who came, anyone, they went into the triage green area and they were there, tested, and they were put into orange area till the report was there and they were asymptomatic. And if they were symptomatic, they went into the red area till they were picked up by the government to go into the COVID hospital. So we did have a lot of COVID patients waiting to be picked up from our hospital because of emergencies, because of cardiac emergency, fever emergency. Our medicine unit is huge. There are 5 super specialist medicine people working. We have a big dialysis unit. So that was under jeopardy. So it was chaos. And then my lead consultant got COVID, the neurosurgeon. And we had a second setback. Everybody ran away from the hospital all over again when we were trying to open. So the hospital, the 200 beds, only 10 were working for obstetric unit because we could not stop obstetrics. Everyone in Agra was coming and doing. I invited all my Agra doctors, come and do your deliveries here, come and do your cesareans here. We will provide you all the universal protection, the PPE and everything. And that is when I started generating infographics. And those infographics I kept on sending to everyone. It's now a book which I'll release. That's when I started writing articles. So there are 10 COVID updates which I've written. And we published the first international paper on COVID on deliveries, 10 deliveries. And then now we have the second publication in the World Association of Perinatal Medicine, which is 75 deliveries in the medical college and 37 at our center. So this is also going to come out this month. So April, it was OB/GYN, then the other departments start opening. The urologist said, wife, what should we do? Mine is not emergency, I'm not coming. So the staff payments had to be made. So everything went into a chaos. For antenatal patients, we were very fortunate that we had an app. And this is, if you remember, 2 years back, Jaideep had made this app called iMums. And this iMums app, we started doing Ask Me Anything session in the evening. And we have now done 150 sessions with one consultant. So we have 60,000 pregnant women logged on to this app now. And we took part in the Atmanirbhar app contest just last week. And I'm pleased to announce that Jaideep was awarded the second place in the Atmanirbhar app. And this app actually started from FOGSI. But unfortunately, FOGSI did not give the name to this app. So we just carried on in the last 2 years. But this app has got the second position, and it's a fantastic way to connect with pregnant women. Now, telemedicine, we were very happy because we have our own Rainbow app for telemedicine. But there's a big medico-legal problem with telemedicine. You cannot advise antibiotics. You cannot write Schedule B drugs. There's only a small amount of drugs which can be written. There's a huge consent which they have to sign. So it is good. You can talk to the patients, but when you're prescribing, you have to be very, very careful. Then we had a major outbreak of COVID in Agra because of the Tabligis coming to Agra. There were a huge amount. And then the private testing, the government stopped. And they did not have tests. So we had to do cases without testing. Right today also, the private testing is stopped in Agra. We cannot get our people tested. So the government has to come to our thing, pick up the RT-PCR swab and give us a report after 36 hours. So we made a routine in all our pregnancies 5 days before delivery. They have to get tested, and maybe now in the first trimester also we are putting in our protocol. Then we had the training. The government officers came and trained in our place, but when they saw that we were training ourselves, so we adapted to the government. So we were training other hospitals. And we had the IMA training, and we of course had the HIMA, thanks to HIMA, the Manyata training. So that Manyata training also went off fantastic in UP and for COVID protocols. And we did training of each and every staff amongst ourselves, and the refresher training is going on from yesterday. So there was a staff fear, there was a patient fear, there was a doctor fear. The patients, when we were talking, we were all masked in PPE and everything. And the patient connect never came, so she was never looking into your. So she was never comfortable with the doctor who was delivering. I delivered baby and I'm carrying the baby and handing it. Oh, you are Dr. Malhotra. Oh, you are. Who is this? So that was a major problem. And IVF unit shut down completely. So IVF unit has just opened 10-15 days back with counseling and frozen EDs. The fresh stimulations probably have just started day before yesterday, and we'll be starting doing that. We were very active in social media, so we kept Agra updated in social media also. And then, of course, we have had the protocol of which PPE to wear and which mask to wear, and did that. So difficult times are still there, and I hope this passes away. Numerology, I'm into numerology, so next Independence Day, 15th August 2021, it adds up to a number of 8. and that 8 is going to be very lucky for us, and probably India will turn on next Independence Day. I don't see this virus going away from us ever, but probably will take a turn by the next Independence Day.
Thank you, Narendra. That I must salute that you all of the gynecologists in Agra have stopped practicing obstetrics, but you continued that and invited everybody for that. That's a very good sign. And obstetric practice, you cannot stop it. And due to the lack of facilities, you are not doing the test. Now you are routinely doing the test before surgery, or still you believe that you take a precaution and without test also you just do the cases. What is your opinion? Now, what is the take-up now in the present situation?
So all our registered patients have to undergo RT-PCR 5 days before their expected day of delivery, if they're going for trial. If they're going for elective Caesar, 5 days before the elective cesarean. And if they stay for any reason for 1 week, then they go for a discharge test also, and a rapid antigen antibody test. Now the rapid antigen is also, we are allowed to do only 10 rapid antigen and 10 RT-PCRs from the government side. So which is very less for my 200 beds, because the neurosurgeon takes away 10 tests.
So in case one comes as a positive, what is your thing?
So I'm coming to that. So if now we are handling a lot of unregistered patients, so unbooked eclampsias, unbooked severe PPH, unbooked retained placentas, unbooked bleeding APH, accretas, we've handled everything in this, everything in the book of obstetrics has been done by me in this recent 5 months, which I've never done in my last 10 years. I had to do here. So now if the patient turns positive, unfortunately, because we are not a COVID hospital, she has to go to a COVID hospital. Yeah. So our hospital opposite us has gone for a choice of complete COVID. So we keep them there. We follow those patients by our advice, but their doctor has to, the government has made it strict. So we have the government medical college, and we have 3 hospitals in Agra, private, which are completely COVID. No hospital is mixed, because the hospitals are not built in Agra like that they have a separate block where they can have COVID and non-COVID. We could have done that, but we opted out of it because my non-COVID patients would have suffered too much if we had gone COVID also. So they go to the COVID hospital, they deliver there.
Yeah, that is the only problem, because in my state also the same thing happened. If they're positive, you are referred to the case must be going to the COVID hospital. And unfortunately, in the COVID hospital, there are no experienced obstetricians to tackle the situation.
Very sad.
I have seen people have, there are a lot of neonatal death, and there is a lot of maternal death also, or morbidity will be more particularly for that. That is really concerned me, that in COVID hospital, I requested the government to make it functional and to be more effective for that. Same thing happened. You can, if the patient is a comorbid condition, who is to take care of them? I think that's a major issue affecting the mortality for that. And that is also, I faced it. And about the test and all that, everybody is the opinion of long back that yes, test is necessary for that. As far as possible, we do the test. But my personal experience, when I say that when I started initial period because I'm at risk, diabetic, open heart surgery, age, everything and all that, people told that don't see patients. I only stopped practice for 4 days. On the 5th day, when I found that yes, one patient came, and that was a case of most probably an ectopic pregnancy, and the patient run from pillar to post from all the places. Nobody saw. All ultrasound clinic were closed at that time in April, month of April, and I find when the patient came, she's already dead. And the same evening, another patient, rupture uterus, received dead. Then from that day onwards, on 5th day, I didn't bother about anything. I started doing a full practice. Till date also, I'm doing all practice and all that. No, only personal protection I'm making it. And even test, I don't, at that time, RT-PCR was there. I don't mean the test for that or routinely. If there is a possible, you can do it. If the patient asks that the test can be done, now antigen test can be done for that. Otherwise, I think the practice I continued for that. Because I felt at that time, I impressed the Chief Minister that our state is very, very proactive, and it's a very minimal death and all that. I told, as per you compare the non-COVID death with the COVID death, the non-COVID death is 50 times more than the COVID deaths. I explained that when the swine flu was there, in 1 month, the whole all India death is 46,000. Nobody
Yes.
bothered about it. But now with 6 months, there is a 46,000, you are bothered so much for that. I think these are the things which made us and think that yes, I must not stop practice. I will continue the practice and avoiding the fear factor for that. And I appealed all the doctors that time that please see patients. And the only risk that I approached the government that if at all a patient comes positive and by chance he comes to your clinic, the contact tracing will come and seal your hospital. I think that is the only danger of our practitioners for that. And that's why I showed that don't seal the hospital for that. And only one hospital was sealed in Bhubaneswar. After that, they realized that the non-COVID deaths are more than the COVID deaths. And that's why they continued for that. Thank you, Narendra, for giving me this opportunity. And I'm still reminded of this ISAR conference where I consider the only two lucky boy and lucky girl. One is Santa Kumari, another is Prakash Trivedi. These, because of the luck, they could do a wonderful conference with 2,500 delegates. That was the last conference at that time. And in the I think dinner table, we discussed about that. Only one person from Telangana was positive at that time. So we decided that the next henceforward, no meeting of the gynecology FOGSI meeting will be there. And the next after 10 days, it was a South Zone EVA FOGSI which got cancelled for that. And since then we have cancelled for that. And at the same time, we requested that, yes, I gave a tweet to the Prime Minister Narendra Modi that the first and foremost that stop international flight. But unfortunately, the international flight was stopped 20 days after, on 23rd March. And even after 23rd March also, some special flights were there to carry people from that. And that is the worst thing that has done it. Unless the source is blocked, I think then you allow the source and then do a tracking and tracing. How you can control that? And that is the situation for that. I gave an example of Taiwan. Taiwan immediately stopped the international flight and all. I think that's one of the mistakes which have done it. And then of course, the shutdown, lockdown, all of you know the benefits and risks of lockdown and shutdown for that also. And Narendra, just a deviation from that. Yesterday, I saw one patient and how the different new terminology has changed, lockdown and shutdown. And when I took a history, I told that when was the last menses? The husband told that, sir, 7 months shutdown. And I shut down, 7 months shutdown. I think you have borrowed this language to the gynecology history taking for that. And thank you very much, Narendra, for the welcome.
As we used to teach, track your last menstrual period with the festival. Now it will be track your last menstrual with the shutdown and the lockdowns.
Lockdown season, yeah.
We still have lockdowns in Uttar Pradesh every weekend. So I'm locked. Saturday, Sundays, we are all locked down.
This is a new terminology which has come to the profession as well as your personal life for that. Well, now is the queen of FOGSI and the past president, Resma Dhilan Pai. I think, thank you very much, Resma. You have agreed to be in this amongst us. And you are the obstetricians and gynecologist of very well-known personalities in Mumbai. And very big hospitals you are practicing and all that. You not only do infertility, you do a general practice also, an obstetric practice also, I know. And you are the master, you are the past, not only the past president, but president of many, many organizations for that also. And I still cherish the memories of your presidency, how versatile you are. And at that initial time, when you took charge, everybody thought that Resma will be limiting herself to Mumbai. I think at the end of the year, from Kashmir to Kanyakumari, from east to west, Resma has traveled and forgotten the family and Rishi and the son and daughter and married to the FOGSI for 1 year for that also. Resma, welcome and have your opinion on that for the benefit of our viewers.
Thank you, sir. Your introductions are always unique, not the typical introductions which everybody gives. So personal and really all of us go back such a long way, and it's wonderful to all come back together on a common platform to discuss some of our practical issues that all of us have faced. So as you all know, I come from Mumbai, from Maharashtra, which unfortunately has the dubious reputation of being the #1 state, now having 5.8 lakh cases and more than 20,000 deaths. And my city, Mumbai, really has been ravaged by COVID, unfortunately. Today we have almost 1.3 lakh cases with 7,000 deaths. And the numbers have been thousands every day. Fortunately or otherwise, they say last few weeks, the numbers are a little bit stable at about 1,200 cases per day. But the periphery of Mumbai, the Thane, the Kalyan, all the neighborhood of Mumbai has got massive number of cases again. And again, Mumbai hospitals are packed to capacity because of the periphery of Mumbai coming into Mumbai, because they don't have the facilities, so everyone's coming into Mumbai. And so all of us are suffering from this particular condition, which I like to call, and I like this terminology, it's acute immunoinflammatory viral disease with significant post-viral phase. I think that describes it quite well, this particular condition. And for me personally, I have had an experience of working in all the 3 or 4 levels of work. I'm attached to 3 of the major corporate or 5-star hospitals, you may want to call it, in Mumbai. So all the leading hospitals, and those hospitals have been actually taken over 80% by the Bombay Municipal Corporation. So 80% beds in all the corporate hospitals have gone to BMC. And that has been a very difficult situation for most people, because when 80% of the hospital has COVID positive cases compulsorily, then the 20% which is open to free people, most people don't want to go there unless they have no option. And initially, like for example, Jaslok Hospital, it's in the public space, so I can talk about it, had a very difficult time. They had more than 100 staff patients turning positive. They had to shut down the hospital. So it was a real crisis, and it really spoiled the name. And then slowly, the hospital limped back. And now most of the hospitals have kept, you know, like Naren said, the green, orange, red zones, separate entrances, separate lifts, separate floors for COVID, non-COVID patients. But still, corporate hospitals still have 1 ultrasound center, 1 CT scan center, 1 MRI center, where every patient of the hospital, COVID positive otherwise, has to go. And all of us know that MRI rooms, for example, are not fantastically ventilated or in big open spaces. They're all small spaces. And so it became almost impossible for many of us who are in that age group, which is a little high risk, to actually go into large hospitals. So for me personally, since the outbreak became quite massive, entry into the large hospitals became not possible, or I have avoided it to quite an extent. And many of my patients who were registered in these, for example, Breach Candy and Leelavati hospitals, have shifted to what I call the medium level hospitals. Fortunately, we have some medium level hospitals, which are, for example, a 2-3 story hospital, only maternity. And, you know, you can climb up the stairs. You don't go in lifts, because I believe lifts are one of the worst places for transmission of infection, because now it's proven beyond doubt that these are aerosol, air generated, and they can stay, the particles can stay in air for many hours. And so the medium level hospitals, where you can climb up the stairs, where they have 2 or 3 or 4 OTs, basically OBGYN, maternity only, and you can sort of keep away the multi-speciality, keep away the other patients, seems to be a bit of a saving grace for a city like Mumbai, which is full of patients. So when they say, you know, a couple of lakh patients, you can multiply that by 10, because testing, as you know, has been minimum. So we believe lakhs and lakhs and lakhs of patients in Mumbai are affected. All around us, we have our friends, our neighbors, everybody getting infected. So it has been a very difficult time for us. But these medium level hospitals have managed to, you know, test the patients. So we've been fortunately that pregnancy patients have been allowed testing. So we test them 5 days prior for elective procedures. I have to confess here that much of the work has now become elective. Of course, emergencies will always come in obstetrics, but a lot of the work, if possible, has been made more elective, either planned C-sections or planned inductions. So that it's just better to prepare for them. Limit the cases. In a small nursing home with 3 or 4 operation theaters, you don't want suddenly a huge crowd of patients coming, because they can't distance, they can't, the number of doctors is limited. So that medium level has worked well. We can provide them with PPs, we can provide protective care, but there's a negative side to it. Because it's a small individual owned hospital, they can also brush up a lot of things under the carpet. So sometimes the news doesn't really come out. Like in a large hospital, everything is reported. You are clear, you're transparent. Medium hospitals, somebody comes positive, there's been a spread of infection, you can just hide it. So a lot of that little thing goes on, which does create a little fear in you. And the third level, the very small, like for example, I have a small nursing home, which is only a daycare hospital. So it's a small, say 12, 15 bedded small daycare center. And that, what we have done, we are doing only daycare cases, MTPs, DNCs, hysteroscopies, small procedures. And there, our staff, we are actually physically looking after their pickup and their drop. Because in Bombay, trains have stopped. That's a huge problem because majority of the people can't afford to live in Bombay city. They all stay 1.5, 2 hours away. And to bring them, as it is, trains are not working. And for them to take public transport 2 hours and reach there, too much exposure. So we have literally 2 of my cars and my drivers are picking up the nursing staff, bringing them to the hospital and dropping them back, literally. And in our IVF centers, the staff has been almost, let's say, a little bit pushed or, really pleaded that you come and stay in the nursing homes. Because if they travel, they are going to expose not only themselves, but all of us. And so the smaller nursing homes, I feel, are doing very well. We are testing the patients and we are bringing them in and we are doing the procedures and sending them back safely without much of exposure. Our OPD is running on a regular basis, but most of our OPDs are running by our younger associates because day-to-day practice is difficult for us to be facing with the patients. So the younger associates are doing the consultation in the OPD, in consultation with us constantly. And the OPD has been now very, very well organized. There is no air conditioning. Everything is open, ventilated. There is hand-free sanitizers as soon as you enter. Masks are given to every patient. We have ultraviolet lights everywhere, even in the private clinics, which, once there's nobody there, they are turned on every 2 hourly for about half an hour or so. 2 hourly sodium hypochlorite cleaning is done. On our tables, we put those plastic, like a little plastic wall, so that the doctor sits behind and the patient sits in front. Much of the appointment has been done, like all of you are doing, appointments are done earlier. All the history is taken earlier, and this I've been repeatedly telling the associates, please take the history earlier. Your face time with the patient has to be less than 15 minutes because all of us know 15 minutes and more is the risk for acquiring infection. So all history is taken earlier. So when the patient walks in, everything is known about the patient and then only their problems are solved. Quick examination is done and the treatments are started. Teleconsultation, personally, I've been doing a lot, but there is definitely a fear when you're writing a prescription for a patient who you haven't seen. So there is a worry. It's very easy to ask for investigations, to see their sonography reports, to talk to them, but significant fear. So record maintenance has to be there, not only for medical legal purposes, but also for income tax purposes, because we are receiving money on digital payments. So all that record is very carefully kept. And also the record of patients, whatever prescriptions, is carefully kept. So I think that particular thing has to be, we have to be careful because this is all very, very new for us. And of course, our IVF centers, again, probably Nandita will talk about them in more detail, but just to say that the larger hospital IVF centers haven't yet opened, but the private ones, smaller nursing homes, we have opened since, actually started IVF work since June. So we will speak a little bit more in detail about that. But overall, I think life is limping back to normal. The fear is still there because every day one of your friends who has the luxury of not even needing to go out, like we have to work, they don't even need to go out, they are turning positive. So I think the fear is definitely there. Unfortunately, in Mumbai, mortality rate is very high. I think it's much, much higher than India mortality rate. Our mortality rate in Mumbai is standing at 5.5%, much higher than pan-India mortality rate. So it's been difficult for us, but we've been, like, for example, in our IVF patients, keeping a record how many patients are turning positive. And overall, between all our centers across India, we have a 1.2% positivity rate while they are on treatment, between the husband and the wife both, because we're testing husband and we're testing wife, going through the entire treatment, and 1% approximately have turned positive. So it's learning times, it's difficult times, but I think we're all coping.
Thank you, Resma, for your brilliant approach for that, covering everything starting from the smaller unit to the corporate hospital, and the lessons learned. And now you have reached a stage where everything has been streamlined to some extent, but still there is a long way to go. And till normalcy, I think we'll wait for that. And we have learned many things out of that, because Maharashtra is the state and Mumbai is a place where the maximum positivity and mortality has been found for that, and a lot of inconvenience, and the public has been, as you said, that transportation and all that are the major factors for that. But I congratulate that you have overcome everything and continuing this, and started infertility work also in the recent past for that. And I hope you'll be spending more time. I don't know whether you spend more time with Rishi during this time, whether you are happy or unhappy, I don't know. Whether Rishi is happy or unhappy, I don't know. Whether there is a more of a tug of war or friendship and all that, I don't know. But I think I want from you whether you are happy or not, in one word.
I think this is actually quite a life-changing experience for all of us, because I don't think any of us have ever spent so much time at home. All of us are FOGSI travelers who are taking a flight twice a week all over.
Absolutely. That is the only thing. Saturday, Sunday means off and all that. Now you are bound to stay with that. Even if you don't like or like, I don't know. But you are bound to stay. And
it has changed life. It has made a new reconnect with the family. And I think the family is enjoying our presence, especially if you are in joint families.
You are enjoying, or family is enjoying?
You are also enjoying? I'm enjoying my grandchildren a lot.
Enjoying our grandchildren.
Yeah, that is the only thing. That's very good. Thank you very much, Resma. I hope, I thank you very much for being with us and spent a valuable time of yours with this podium for that. Well, now the turn is again one of my favorite. Still, I remember my vice president, whom without whom I would not have done my presidency in the year 2011, Nandita Palsetkar. So you are so down to earth. I realized that time that you are absolutely down to earth. You are not only a past president of FOGSI, you are president of many, many organizations. And moreover, I can say that you are one of my family members for that. I have an emotional connect with you, Nandita. And I don't know what mesmerism you have created with skilled people, I don't know. When the program was started, and Balaji told me that you can select any number of past president, but you cannot ignore Nandita Palsetkar in that forum for that. I think you have done a wonderful job for that, and you are also our favorite, all of us favorite. And I welcome you to speak something and relevant topics. You are a master in infertility for the last so many decades. And I know you are part of that, my center also. And I will just want to know what is your, since March till date and further, what is your take-up, particularly for the infertility and advice for the infertility specialist on this COVID pandemic? Nandita.
Thank you, Dr. PC. As previously been said by Rishma, that you give a very unique introduction. So thank you very much. And I think our association for so many years has really bonded us. And I think in FOGSI, everybody that way is bonded with each other. I want to begin on a positive note. Like in Bombay, in Maharashtra today, the recovery rate, recovered is more than 60%. And have gone home absolutely fine, and the others are in the process. So I think the problem we had with a lot of meetings and all is that the patients are coming late to the clinic, PC. So the patients are not reaching the COVID hospitals early, and that's why they are having a lot of problems. And I feel that when we talked about the small nursing homes and all, they said that patients are dying of non-COVID reason, but because they are positive, the COVID is included with them. So I think that is the whole scenario. And today I was just reading the whole all India mortality rate is 1.53%, which is way, way, way below the swine flu mortality rate. So I think what we need to do is we need to accept this disease, take precautions not to contacted, but at the same time reassure people that it's not the end of the world. So I think on that note, I would like to begin that when March came in and we were told lockdown, all our cycles, because of we had an idea that something like this is going to happen. So Delhi, Bombay, Bangalore, all the centers, New Bombay had finished by 15th March. Our only cycle back was left in Mohali. And Mohali that time was in a bad state, and we had to actually cancel 30 to 40 patients, in that particular period. Am I audible or?
Yeah.
Sorry. Okay, because everybody is frozen. Okay, so we had to cancel the cycles, and a lot of patients did grumble about it, but everybody was scared also. And I think that's what happened is we told them that we'd give you discounts. Now we have to be, I feel the mantra during this time is be kind. Be kind to everybody because everybody needs help. And also people react very abnormally because they are under a lot of stress. So I think being kind is very, very important. So when we shut down all the units, we had to take precaution that the liquid nitrogen containers, or we do a lot of freezing. We have about 30,000 embryos frozen. So all those had to be maintained. So we calculated the amount of loss of the liquid nitrogen, and we figured out that every 10 days we had to, refill our containers. And the boys had disappeared, because they could not come and they lived very far away. So we had a local liquid nitrogen container vendor, and we got in each hospital. In Leelavati, we got the security of Leelavati to help us out. We filled those containers. In my personal hospital at Opera House, we had one nurse who would come and open the hospital because our small nursing rooms had shut down. So liquid nitrogen was maintained throughout in all the facilities. The second thing that was very important was the PCPNDT register. See, we have to fill PCPNDT register every month. And it was very important to give it, though of course they've given laxity for the thing, but I think all IVF units must remember that the PCPNDT register has to be filled every month. And we had a problem in Bangalore where it was not sent on time, but because of the COVID era, they accepted it. But this is something that we have to do. Then the next thing that happened was we decided to open the clinics. ASHRAE came up with the thing that you can start clinics. Then ISAR, IFS together and ACE together formed guidelines. Even through AMOGS, my infertility committee formed guidelines to start. So we kind of started consulting telemedicine and started accepting patients at the end of June. And in July, we did the cycles. Now, let me take you through how we started the whole thing. So the first thing was we decided that we must have a COVID-free IVF center because patients were refusing to come to Leelavati Hospital. So we had to open up a small. DY Patil was not a problem. It's in a separate building. The COVID ward is in a separate place. So that again was not a problem. So DY Patil and our Opera House Center was started. The Delhi Center at La Femme was started, Gurgaon was started, and Mohali also started. And what happened was in the OPD, you were asking how will you take care of social distancing? What we are doing is giving patients, every patient 20 minutes appointment. And only one patient is allowed to sit in the consulting room, one patient in the waiting room. And if another patient comes early, he's told to wait down or in the car, not allowed to come to the hospital. So that is some way in which you can try and space out the people. The second thing is teleconsultation, as Hema has mentioned and Naren has mentioned. We do a lot of it. So all the work is done on teleconsultation, and once the patient comes to us, of course, as Rishma mentioned, we have all youngsters who are manning it. My son, Dr. Chitika, all of them are under 35 or under 40 who are manning all the OPDs, and they are seeing the patients and they are getting it in. The problem that we perceived was that, sonographies. Now, when we started, one of the patients did one day 2 sonography and then was coming daily for injections, and she came positive on the 4th day. So that was another thing that we had exposed the hospital and the unit. So what we did was, after that situation, we separated out the consulting from the IVF center. So all those who are doing IVF should be able to isolate the center so that you don't get your patient in there. And everything was done outside the center. Even the consulting, the sonographies, and the injections were given outside. Now we've really switched over to subcutaneous injections also, so that the patients don't have to go to hospital daily to get it. It is expensive. It is a little, but some people are willing to take it. So we are doing that. Secondly, the sonographies are completely outsourced right now. The day 2 scans, the day 7 scan, everything is completely outsourced. We are sent pictures of the sonography, showing us how it is, and over the telephone we manage it. The injections are delivered to the patients. All the companies are helping us deliver the injections so the patients don't have to get out also. The third thing is the COVID testing. What we are doing is we're doing a COVID test on day because a lot of patients, they've taken injections and cycles got cancelled midway because they became COVID positive. Bombay is a hub of it. So what we are doing is we're doing a COVID test on day 2, and then 2 days before the trigger, when the follicle is about 16 mm, we repeat the COVID again. So this way we are planning so that we have a COVID-free test. Now, once the patient comes in for the pickup, say, now, what I personally feel, it's a lot of disposables, lot of things which will be, one way, yeah, we have, the pollution is less because of cars, but we are creating so much PPE pollution, all the plastic ware and exactly. So all over the world, and what we have done is that when we do the pickup and all, we use the PPE, but otherwise there is, just a face shield and a face mask which is there when the people are consulting. We don't use PPEs while consulting. And of course the patients are tried, but pickup is done with this, and pickup is done with the minimum. You have only the doctor, 1 staff nurse and 1 boy. And the embryology lab is the safest because there are air handling units, the air is changed frequently. And good news is that enough publications have come that the eggs, the sperms, and the embryos are that way COVID free. Though the temperus receptors and the ACE receptors are present in the are present on the embryo, but because of the dilution and, frequent washing of these cells, they are not present on these cells. So these are the things. The other precaution that we have taken is that the liquid nitrogen containers are separate for the patients post-COVID. Whatever pickups we've done, whatever embryos we've created and frozen, they are in separate containers. Now, we've not had any patient like this whose pickup we've done, and then after 5 days later, she's called us and said she's symptomatic or COVID positive. But when that comes, we'll deal with it, I guess. But otherwise, we are taking precautions that the minimum exposure is there. Another thing that I wanted to tell you is the staff, which Rishma also mentioned. But in my hospital now, the staff is staying for 15 days. They stay for 15 days, then go home for 15 days. So the staff who is not using public transport. Whatever staff can walk to the hospital are coming and going back home. But the rest of them are on 15 days duties. And we've tried and divided our people into 1/3. So 1/3 staff is operating now, then if they get exposed, as I said, say 5 days later, a patient tells me, then I may have to quarantine. But the quarantine rules in Bombay have changed. And I think we are understanding the disease better. That if you're wearing a PPE and you are exposed to a patient less than 15 minutes, you don't have to go into do a COVID test or anything. You wait. If you're symptomatically, you're fine, you don't need to bother. Even the hospital now is not sealed. if there is a COVID positive patient who has made an entry, but if the people around have taken precautions, social distancing, hand washing, face hygiene, etc., then that hospital is not sealed. Only one room where the patient comes in, we clean it with sodium hypochlorite solution and UV lights. And a lot of UV lights are placed everywhere, even in the hospital corridors and all. And we are not taking in any patients who are not tested. Even the husbands have to be tested because we're taking the semen sample and all. So these are the things. Now for frozen Tahiti, there was a problem that for consent, the husband had to come inside and he was not tested the first time when we did it. So what I have told them is send them everything on the mail, let them sign the consent papers, and when the mother comes, she brings the papers because she's anyway tested. Anyway, she's exposed to it. So I don't know how much, it really helps. But these are some of the precautions. Mentally, at least you feel good that you're taking all these precautions. Then, of course, I think I've been doing a lot of webinars about what to do in COVID and what not to do. That has been very good. And what else did I want to mention is, and the recovery rate. I think it's amazing the way Maharashtra has fought back, or probably the whole country. The government has been very, very proactive. The contact tracing is so immediate. It is amazing. I had a person in my building who became positive. And after 3 months of really taking care and all that, he came up for chai. We just called him up for chai and he turned positive. So the municipality came to us and everything was taken care of completely. So I think the government has been very, very efficient. And we are taking care that there should be no OHSS. Sorry, that was a very important point which I must mention, that all GnRH analog triggers, no OHSS, try to minimize it. I'm using a lower dose if I find on day 2, the ovaries are very hyperstimulated. Because meaning if she's PCOS, because if this patient turns positive in between, I will have trouble. So we cancel cycles, we offer them discounts if they turn positive. But as I said, we've hardly had more than, not even about 1%. But another thing is, we have done only 25% of the work which we did last July. So yes, that the people are also scared of coming. So I think we all need to, hold tight, be together. We are offering a lot of discounts to people because a lot of people have lost their jobs. I must tell you, one person paid the money for renewing the embryos, and then he called up the next day and he said, sorry, I've lost my job. Can I have my money back? So we refunded the money to him. But that is the situation right now. And that's why we need to really, be kind, be sympathetic, and conserve. I think conservation is very, very important. Thank you.
Thank you, Nandita, for enlightening us regarding the guidelines, particularly in infertility practice, and you have designed your guideline and follow up it, and that will be very useful for other fertility specialists for that also. And a special salute to you for your charity. I think that's a really a commendable job. Instead of hiking the price, you are giving discounts and charity, and the future will say what will happen and all that after normalcy. I hope that you are more optimistic and you can do a lot of things. And especially I must compliment you that you are till date, we are not able to find a vaccine, but you have found a social vaccine. And the social vaccine is very important at all stage for that. And not only social distancing, but as component of social vaccine, you have introduced it. And this is an innovation in the practice of gynecology and particularly in infertility. Thank you, Nandita, for your brilliant exposure and view. The only thing I'm apprehending that what about your travel and all that? For the other centers like Bangalore and other places, because there are the rules. In Orissa, there is a 72 hours, you must stay there, there's no problem if you come back. In other states, there is a 14 days quarantine. If you go to Bangalore and stay for 14 days, you have to ask HEMA for giving a shelter in Bangalore for 14 days for that. What is your take up on that?
Process. I'm going to tell HEMA to do the process.
So that is not going on. I think if after normalcy is going on, all the centers will work in full strength for that. Thank you, Nandita, for that. Now, last batsman, and it's the last but not the least, is the most versatile personality in FOGSI, and not only as a presidency, as the president of ISAR, is conducting a lot of things in the ISAR forum, and a luckiest person, which I already ventilated to you, that he is one of the luckiest person in FOGSI, Dr. Prakash Trivedi, and he is known as a versatile endoscopic surgeon, infertility specialist, and endoscopic, exoscopic, everything he does it and all that. And thank you very much for keeping some time from an international assignment to the national assignment and the sealed healthcare and this webinar and interaction for that. Dr. Prakash, I will just want to know, and specifically everything has already been taken, starting from Hema to Narendra to Reshma and Nandita. You must focus attention particularly. What is your experience on the endoscopic procedure for that also, with this special note for that in the COVID pandemic? Unmute, unmute.
Yeah, with your permission, I will not talk on endoscopy.
You can talk anything on that.
No. See, I think
Anything
so. What
on
happens
COVID?
is, this we have discussed many times. Whenever in life there is a crisis, no, that is the time when we are in the best color. So
And genius is born in crisis. I remember your version.
Yeah, geniuses are not born, but they are born to exhibit in crisis.
Yeah, yeah.
So basically what happened is we had a after that good conference in Hyderabad, when the things came in. What I realized is we had a 4-pronged attack thought process. The first thought process was understand the enemy. So I went into too much of details of COVID with virologists, with pulmonologists, with immunologists, and trying to understand what not. So many things. I can now do PhD on COVID. So unless and until you don't know, and this is an enemy which is smarter than your intelligence. So that is the first thing which we did. Went into too much of details and timely discussion with either an intensivist or a pulmonologist. So that was the first part. The second thing, I think, so what you have is your army. Your army is your staff. So we had, apart from the staff who could come, who could not come, there is one sister who was staying for 2.5 months. There are other receptionists staying for 15 days, another 15 days. Very senior OT assistant, I think so. Reshma must be remembering Anthony from. So he's 67-year-old. He comes daily in his car. So basically, we explained to them. And after ISAR presidentship, up till now, I must have addressed 35,000 consultants, of which 6,000 plus we addressed for COVID. And in this group of COVID, one of the main group which I addressed was in Hindi, Gujarati, Marathi. Vast places of gymkhanas, buildings, families, in their own language, that what it is, what not. Because if you have 13 buildings of 13 floor, I think so educating people only makes sense. So the moment you means that fear psychosis goes down, and then suddenly people find, okay, because otherwise sometimes people feel, oh, doctor, he will be having more chance of infection. So then I started formula for all various societies, various gymkhanas, various things. Then for patient, we were very simple, and we had a lot of interesting things which happened during the COVID time. For patients, we had the receptionists, 2 people working from their home, used to triage them. So there's a full-fledged question answer, everything put. And like you, not more than 2-3 days we actually kept closed, because our consulting was going on, deliveries were going on, abortions were going on, IVF was on standstill. Laparoscopy, that's the 4th thing wherein we have found a absolutely new method which Hema is aware, and it is getting published. It's one of the major breakthrough in the world, that how you can do laparoscopy in COVID time. So we had almost 40 laparoscopic surgery, including various things which we told you. The change what I realize is for the first time, I realized the importance of being obstetrician. And that is what, when you're obstetrician, patients are worried because, as they were telling, corporate hospitals, say Fortis is there, Fortis is COVID hospital, Hiranandani is COVID patient, all those patients are coming to you. And forget about fertility. I had 18 patients of abortion, means in 3 years I must not have got so many abortions. So there were 15 first trimester abortion, 3-4 second trimester abortion. But you have seen our consulting place. So it is a very spacious place and it's a 5-floor building. We are the kings only on the top floor. So all the triaging, everything was done. So if it is 11 to 2, only 6 patients are seen. If it is 11 to, if there are 8 patients, means another, and then all me, Preeti, Somil, Aditi, all go daily to the hospital. Daily to the hospital, do morning work, either it's surgery or Caesar. Now I will be going to do a Caesar at 6:45 or so, the one which we induced today morning. So our basic plan is that you identify that you don't get infected and you don't infect. So we had an entire screening of our staff. We had all the patients who came. After they came in triage, then we had specific way in which we had the temperature, pulse oximeter, this, that, all the precautions which are taken to have a good consulting. The important thing we have to realize during this time, I think so, Hema and everybody will agree, Narendra also, PC, patients coming from Dombivli, Kandivali, South Bombay, Lodha group coming from Jaipur for doing a myomectomy, everybody coming, they are feeling so much obliged with the hospitality and concern and care with which you are talking to them. So, you are taking their first care and everybody gets, okay, this is our website, this is in Gujarati language, this is in Hindi language, this is in English. All you want to know about COVID, you will get an idea. Now what happens is the fear goes down. Now my point was, okay, we have a patient of delivery, we can't refuse. Somebody wants abortion or it is missed abortion, we have to deal it. We had a rare combination of ectopic and appendicitis together. My problem was, what is the problem of that female who is having multiple large fibroid and she's badly. So one corporate, Paraksha, who handles the entire quarantine of Bombay. So I just casually told him, imagine if your wife's surgery was supposed to be done on 15th of March. Will you wait till January? But there are patients with cancer. There are patients with a lot of problems. I told you, women's problem, a typical women's problem. You cannot say we can hold them. So they used to feel happy that A, immediately somebody is answering. B, immediately details are being done. C, whichever doctor they are asking, whether it's Somil, Prakash or Aditi, they are available. Proper care is taken. Everything is absolutely done more methodically. And being our own hospital, it becomes a little bit easy. For example, you have one patient of hysterectomy, one cesarean. I am going to do a cesarean now. So that patient and one relative will be allowed. Tomorrow there is a hysterectomy, which is also a sister. Now to add fuel to fire, she is HbSAg positive. So we are going to do a lap hysterectomy, keep it in the different section. Day after tomorrow, there is a laparoscopic recanalization. So in the entire period, we could do 40 proper laparoscopic surgery. And in laparoscopy, Hema has all the details, all the secrets, everybody's secret Hema has. So the entire thing, how to do, PC, I'll be discussing with you. It's a mind-blowing research which has worked. Now the problem is, we are essentially very clear. We want to triage and we don't want a COVID positive patient. Because when the government came to us, so we told, look, I have to take care of the IVF twins which is there. Somebody is going to come and deliver. Somebody is going to come and abort. I told, we cannot club our female health with the COVID patient. They understood it within no time. And we showed them the actual day-to-day what is going on. Only thing which stopped was the evening consulting room. evening consulting obviously in this time gets affected. But the important thing was that out of word of mouth, people realize, okay, there is a obstetrician available. Okay, there is a laparoscopic surgeon available. Okay, there is a person who will give pills for abortion, or there is a person who will take care about the mid-trimester abortion. And we made a rule for them smartly. Our cook and servant had not left. So we kept them in the house only. So each patient who gets admitted, so today sees her and husband or mother, her food and everything will go from our house. So they don't have to go anywhere outside. So nobody goes out, nobody comes in. Tomorrow's hysterectomy, she's a sister herself, and her sister is also a sister. So we have told her also, because sisters can have too many sisters. So only one person allowed. That also is a fixed person. So in this fashion, what has happened is there is so much of comfort at the hospital. In fact, that Loda group builder, she came from Jaipur, I think so. Uteta had sent, and she was so happy. She was feeling that she never realized that such a big fibroid is removed, 3 days are done, and of course, money was no problem. As they are telling rightly, we have Trivedi's charity, parents' charity. So we have done 2 IVF free in this time. There are some patients, like the recanalization patient I'm telling, normally it can cost quite a bit. I just ask them, what is it that you can spend? So they will take 60,000. I told, okay, it's fine. We'll keep it on Tuesday. So this is not a time wherein, you can see whether our services, पौने 2 लाख का surgery 60,000 में क्यों होगा. So I think so it really doesn't make much difference. Counseling and educating patients, and the biggest thing what I did is I kept meeting good politicians. By good politicians, I mean lot of money, lot of charity they want to do, but they really don't know what is the disease. So I used to have a webinar, and I used to see to him that he is listening the webinar. And then I used to go and ask, because there were times, Reshma and Nandita will know, you can't do RT-PCR at the stroke of head. Initially, no, isme karo, isme mat karo, yahan karo, wahan mat karo. So we made a blanket rule. All the patient who needed some surgery, we told you, she's having fever, and she's having cough, and she's having breathlessness. Nobody is going to go through the lung. Then the test was allowed. And sometimes the tests are done in such a fashion, there's so much of rush that patients are worried themselves. So basically identifying resources. And one very good example, I will not name the person, one of our account person staying in Dombivli, because he was advanced in age, he told, no, I will not come for work. So he is the only person who got COVID, because his son working somewhere in hospital in Dombivli, he got COVID. That maternity IVF and Endo hospital had 12 patients of COVID. They got COVID. None of all the antigen, etc., everything was done. 4 or 5 were positive antigen. Nobody's RT-PCR was positive. So our primary job is that we have to show compassion, give hope, tell people, anesthetists, 2 senior anesthetists just can't come. But there's one anesthetist who is absolutely fearless, cancer, this, etc., etc. In fact, on 5th June, I had called Shailesh also. We did that bowel resection also at that time. The main thing in this is building confidence with the patient's relative, and making them understand these are the precautions which we are taking. These are the precautions you will have to take. This is what we are doing. This is done as a routine. And 14 days prior, they don't have RT-PCR is done prior. They've gone for surgery. Anesthesia method is different. HIMA has a double closed circuit and 6 filter system we have introduced in laparoscopy. You can do any laparoscopy, even in COVID positive you can do it. But here we are still sticking to COVID negative patient. And the entire thing has worked in such a good fashion that everybody has gelled. So sisters have gelled. Problem about pay comes, one sister is there for 2.5 months. So she gets triple pay. The sister who cannot come, first month she gets full pay. Second month, 33% you have to reduce because they don't have an expense. So basically, I think so creating that atmosphere of positivity, then all the lifts of our 13 buildings here. So we have put sanitizers in the lift, Trivedi's Total Healthcare, at our cost. Our point is, if they understand that these are the people who are not just interested in laparoscopy or just not interested in money, they are interested in well-being. And I always tell my biggest concern is women's health. Women should not get, mothers should not get, sisters should not get, husbands should not get. So I think so we all are actual brand ambassadors which can allay the anxiety. Few things may open by November, December, some physical meeting. Impact will remain easily till April. But I think so we should have a good, I will send the detail of that CD PC which I'm telling. We have to form a good source. So patients who need, because women may need for anything. Incontinence has gone down. Nobody's feeling incontinence. IVF obviously has gone down. But rest of the work is, it is as and how it comes, and patients are very happy. Nobody was available from 11 to 2. Now it is available. Yesterday, 15th August, my son was having 2 confirmed consulting. Now, quarter to 7, I have to go and do that Caesar of one primary. I'll go into the OT, my son and all, they do it. But what I'm trying to give an idea is, understand within risk, within specification, you teach your staff that everybody entering, temperature, O2, this, that, etc. Because all this, everybody moving like astronaut here and there, they sometimes look like jokers in consulting room. So primary thing is good hand wash, good face cream, limited amount of cover, taking the history, and consent, which you ask PC. Consent we take a disclaimer. Okay, you know that there is COVID going on. You know that this surgery is done during COVID time, and you are aware there can be unknown risk to it. And they're nicely, because the biggest risk is from the anesthetist while intubating, and vice versa. So basically, I think so we have to form a group like how group we have, share many common points, and then we can have a platform wherein we can start in it, because economy has to build, company has to come up. As they were telling, all my sisters' husbands' job are gone. So you have to start understanding that this is a big responsibility on our hand. We are fortunate that we can do so much of services. A chest physician doesn't sit in consulting room. There's so many physicians who are straight away going to come in 2021. So I think so gynec by nature are the warriors. So I think so that is a war which we have to continue, and we have to project what is best known. Like today's, what all things were important. We put it together, and after some time put it together, and we will find out the way.
Thank you very much, Prakash.
We may be distanced too much socially or otherwise, but we are divided by COVID, but united by our passion.
Absolutely, absolutely.
For the female.
I completely endorse your statement, Prakash. You are really amazing for taking an extra precaution. You are taking one step ahead precaution, and that's why I'm apprehending. I will ask one question. Yes. Is there any occasion in which you deal with all educated patients and all that at an end? So is there any occasion where the patient asks that, sir, you are advising COVID test for me as well as one of my attendants. I want to see your COVID positive test, whether your staff and the surgeon, whether you are negative or positive, they will not, whether that has been done or not.
PC, before they ask question, all our staff's antigen test is done. And all who had positive, we did their RT-PCR. So we told
how many days interval? How many days interval?
Our staff.
How many days interval you do it?
See, if
Every 2 weeks?
if
Every 2 weeks?
IgM, if the antigen is positive
Yeah.
and RT-PCR is negative, you're not worried. If
Not worried for
antigen,
5 months, 6 months?
no. But you are not going to do for a patient also every 3 months. You
Yeah.
cannot do every. So basically, the staff. See, one sister is who stayed for 2.5 months. Why I should do test for another 9 sisters? So what I'm trying to give you an idea is there, and in that, the one thing I found, जो घूमते हैं ना ज़्यादा, बहुत घूमते हैं, वो सब लोग का एंटीजन पॉजिटिव आता है. Means they are
Not
sensitized
necessarily.
somehow.
Not
They are
necessarily.
sensitized somehow. So
It is
basically, I
not
think
necessarily so. Prakash, we see that there is a survey, this serological survey clearly depicted that 26.6% are seropositive. Who knows that we are not positive? I have not tested, but who knows that I am not positive? You are not positive for that also.
no, but we do.
Because 98% are asymptomatic. We know that, and that cannot be a perfect sense in terms of science.
6 weeks. You can repeat test in 6
Yeah,
weeks.
yeah.
So basically, you do test. Then, if there is somebody who is not well, and that is another important thing. Billionaires, big business builders.
Narendra wants to speak something. Narendra is raising
Yeah,
fire.
so what we have decided.
Then one Narendra क्या था?
Okay,
See, all the people who have a lot of money.
Nandita wants to
एक
speak first.
ICCU में जब बेड चाहिए उनको, ICCU में बेड चाहिए, तो सेल्फ क्वारंटाइन से कितना काम कम होता है? नरेंद्र?
Yeah, Narendra.
So what we have adopted is that every 6 weeks we are doing community testing or floor-wise nursing. So we take 10, 15 who are working on the gynec floor, and all of them are tested community. If comes out positive, then each one is tested. And similarly, those working in the high-risk areas, the red triage areas, those are community tested. And we're not believing still on antigen, we're doing a RT-PCR community testing. That's what we've requested.
PC, with your permission,
Nandita, you want to speak something?
I'll go for Caesar. PC.
Yeah. Thank you very much. Thank you, Prakash. Thank you,
First
Prakash. You
time
are very much afraid. You are doing all the things, but very much afraid of COVID and taking extra precaution for all these.
Thank you. Enjoy.
Bye, Prakash.
Nandita, you have a point?
Was maybe positive from Lucknow itself. We were traveling so much till March.
Yeah. See, positivity and all that. People are running after positivity and corona only and all that. I think I was just interacting with one of the news channel just 2 days before. That is it not a man-made disaster or a man-made endemic? It's a man-made endemic or a pandemic which has created havoc and phobic situation all around. The hatredness is more often. The fear is more often for that also. And when it will go, the corona meter, when it will be down by journalists, then it will go. And unless we search for positivity, I think every effort should be done for reducing the mortality. That should be the first priority. Forget about it. I may be wrong. I may be infected with that also, but I don't care and leave my profession and go and very much involved in that positivity and negativity for that also. So thank you very much, all my learned leaders in FOGSI, as well as the pinnacle of scientists here who have given a lot of time and got a lot of energy and a lot of wisdom for their COVID-related things and various aspects. I think the take-home message is very, very important. I am really, really glad to know that Nandita has revised a word called social vaccination. I think that's a very important. Precaution should be there. Innovation should be there. Implementation. I think the implementation, how it can be done, as Hemas has already pointed out, I think that has to be carried out for that. And I'm really thankful to all my friends, all my well-wishers, and all my FOGSI presidents for giving their time and valuable inputs during the corona pandemic time. So the last message I must give, and I'm proud of my FOGSians, that it is the only profession in medical science who have not left it profession. You forget the physician, the surgeons, everybody has escaped for that. I'm proud of my gynecologists that from all over India, gynecologist has never left their practice. Their really human touch is there. They cannot avoid because they have a heart incorporated to the hand and head. That is there for them. Nobody has a heart, but we gynecologists has a heart that has proved that we are the real corona warriors in this critical juncture and critical moment for them. Thank you very much. Over to Prachi. I think the next program.
PC. Pleasure interacting with you.
Thank you.
Thank you, sir. Thank you
The
very
next
much.
program, Prachi, I hand over to you, and Aniruddha is here.
Thank you. So may I request and invite our CEO, Aniruddha sir, to please give us a little preamble about Shield Connect. So over to you, sir. I'm very happy to invite you. Over to you.
Welcome, Aniruddha.
Thank you, Dr. PC, and it's my privilege and honor to be sharing the screen with 5 past presidents of FOGSI. This opportunity is massive for us, and as we are trying to do multiple things in the area of women's health and joining the hands with gynecologists, as Dr. PC has said, gynecologists with the heart and head both. So I would like to take this opportunity to request each one of you to join us in inaugurating the Shield Connect platform that we are creating exclusively for women's health. I don't have to add importance of e-connects during Corona times. Each one of you in your own practice has said the relevance and importance of e-connect to the patients. What we are trying to do in Shield Connect is to ensure that the attempt is to ensure that each of the gynecologists gets to know what the leaders have to say. So education, sharing, building confidence, and addressing the needs of the patients and the doctors both is an attempt Shield is trying to do through Shield Connect. Each of these will be at the front of building the connect between the gynecologist and between the needs of the patients and the gynecologist. So I have a small video for you to view for all the patients, and then I will request each one of you to please join us in inaugurating the Shield Connect on this auspicious occasion where I have the galaxy of FOGSI stars helping us to build this connect. So may I request Chitrakala to play the video, please? Thank you, Chitrakala. May I now please request Dr. Narendra, Dr. Reshma, Dr. Nandita, and Dr. Emma, along with Dr. PC, to please help us inaugurate this effort of ours. So I will request Dr. PC on behalf of all the panelists here to click so that we get the visibility of our click. eConnect platform. I think with all your consent, we have you joining our Shield Connect platform as an inaugural panelist. We look forward to a lot of interactions, lot of inputs, lot of connections getting built on this platform as we look forward. Over to Chitrakala, if you can give the glimpse of the website. So this is the website where we'll obviously have the doctors forum. We will have the platform for connecting the doctors at one place to build and learn from case studies and experiences from each other, as we have seen the leaders speaking today on managing the COVID cases. We will have the patient outreach from menarche to menopause, as women's health is special, and I heard Dr. Narendra saying that women are special and they require our attention as and when they require. So we will offer our effort to ensure that we are there with menarche to menopause, complete and holistic infertility solutions, and not last, but most important, improving the quality of pediatric care as we get into maternal and postpartum. So thank you for each one of you for allowing us to share this occasion for the launch of Shield Connect. I request
Thank you and all the best. Thank you and all the best. And I hope that this will be really a remarkable, I think, endeavor for on behalf of Shield Healthcare, and that will really cater a service for the benefit of the women.
All the best to you all.
All the
Congratulations, lovely initiative.
Great going, Shield Healthcare.
Over to Prachi.
Yes, sir. Thank you. Thank you, sir. Thank you, Aniruddha, sir.
Any opinion, any feedback from the viewers? One or two, if you can get it, and we can pass it on.
Yes, sir. There is a lot of feedback regarding your talks.
No time?
Yes, sir. There is one question. There is one question from Dr. Kusum is there, and the question is, if the rapid antigen test is done within the 5 days of delivery and it is negative, and the patient is asymptomatic, she has no contact with the COVID-19 patient, and she has no travel history as well, then can we consider this patient as a negative, COVID negative? So what's your opinion? That's the question has been asked by Dr. Kusum.
Emma has already clarified. Yeah, Emma and Narendra has already clarified. Yeah.
Yeah, because if the rapid antigen is negative anyway, RT-PCR is the gold standard. So that has to be done to declare her COVID status, if you wish to, because if she's asymptomatic anyway, going home, so many asymptomatic in the population are not even being tested. So you can probably even leave her alone. But if you're keen on knowing her status, if the RT-PCR has to be done to give you the final yes or no.
So a rapid antigen test has to be confirmed with an RT-PCR.
Yeah.
A positive antigen test is a positive. You can take it as positive.
Yes.
So you need not confirm that, but a negative has to be confirmed.
Right, sir. Thank you. One more question is there. If the attendant is there with the patient, so do you ask any testing for this attendant as well?
Very good question. A lot of times this is being asked. So what do you say, Hima?
We don't ask for the attendance test, but we have to, as I told once before, and again I want to reiterate that all the precautions any which ways have to be followed. You know, the distancing, hand washing, masking, etc., everything has to be followed, but we allow only that one attendant to come. Yes, and then also obviously no crowding, and then different people walking in and out also we do not. That we are very, very strict.
Emma, I have one doubt. If you allow one attendant and you are doing test for the patient, why are you not doing for the one attendant test?
There No, it is not. See, even, as per the guidelines which are
As per guideline, it's
documented,
not necessary.
unless
It's
that
not
patient's
mandatory for the
relative is
patient also.
undergoing unless that patient's relative is undergoing a procedure, we are not mandated to do the test. That is point number one. Second thing is, as you yourself said, Mahapatra, that today the test may be negative. How often you'll keep on repeating is one question, and then even if that patient is positive, but in the incubation, at the moment that when you're doing, you will not. So you have no clear answer. Even if you do the test to a relative.
What is the message? Don't do any test. What's the message?
No, if the patient, no, you have done you have done the patient's test. If the patient is positive, he becomes a contact, then you have to test it.
Then it's all right.
Yeah.
But if the patient is negative, the patient's husband may be positive.
So
the patient may be positive.
So when
why are you
the
allowing to
husband-
the hospital?
When the husband comes to the hospital, he has to follow a clear. We give them a kit, and the kit includes a face mask with a plastic shield and a plastic kit and a sanitizer, and they have to remain.
There is a chance that they
that
will. That is a source of infection for your hospital also.
Yes.
No, but that potential problem, PC, that potential problem will remain. No matter whatever you do.
My message: don't do any test.
Hospital.
Just only precaution. That's all.
Possible. As much as possible. If
there is a guideline, government is forcing a guideline for that also. That is for a legal purpose. Will do it. I think there is no guideline for that, and there should not be any guideline. If 130 million people have to be tested, then I will agree for that. It's not possible.
Yes,
not possible.
It doesn't serve any purpose either.
Doesn't serve
because
any
whether it's positive, I mean, if it's negative also, it doesn't even mean anything.
So that's why I told that since the inception of human race, I think the height of global scam is corona, and the height of global hoax is corona. I think it's a man-made disaster, and by making a shutdown and lockdown, you are prolonging the peak. Normally, what happens if you take the history? And that's why I told that swine flu, all these having a more of mortality and all that. Nobody bothered about it. I think when mortality is less, my main target is that the mortality.
Dr. PC Maha, I want to place on record that as of now, there is so much uncertainty and so much confusion because enough is not known. Okay, how it will evolve and what will happen, we don't know.
We are only running after positivity, negativity. We are not running after mortality.
But I think what time has brought us is more knowledge about the disease. The whole concept has changed from March, how we were treating in Italy and all, to today, what the treatments are. So I think this is the learning curve that we had, and that's how the mortality has come down. And it's probably time now to be very bindas, like as you say,
I am bindas from April. From April onwards, I'm bindas. I told that lockdown is important for 4 to 6 weeks, not beyond that.
No, I think the confusion.
Lockdown 4 to 6. That will give a buying time to bring and update the hospital, COVID hospital. That's all.
The confusion is also because we don't know, potentially, even if I'm asymptomatic positive, who has come in contact with me, some will turn positive, some may not even turn positive. So that is the kind of a confusing situation which is prevailing. So that is so one important thing which Shield Connect should do on this platform is, as it is, the documented detailed case histories, will have to be noted and shared, because if we really do, like HIV testing, we do the testing for all pregnant women all throughout, then we at least come to know how many asymptomatic positives and what is actually the cause and effect of fetal growth restriction or DIC or anything, any damn thing that is happening.
Time will test.
Yes. So unless we document it, then
that I fully agree.
Through that.
For scientific purpose, that's all right. For
giving further recommendation and guidelines also.
That innovation, I like it, but implementable is a major part for that.
No, at the moment, Mahapatra, another 6 months to 8 months. Okay, if we test every pregnant women, at least that segment, we may get a few answers to the ending and what is the kind of policy and recommendations that we may have to make, because we are totally blind to anything that can happen because
only
of COVID.
One target for human chain breaking. I think in country like India, it's never possible for that, human chain breaking. And therefore, I accept social vaccination is one problem, one important thing, mask and your precaution like gloves and other thing and all important for them. That I'm universally emphasizing that also. And
Yeah,
at risk person, I think UK part.
we have to underline that, because doing a test and having a false sense of complacency is a complete no-no.
No.
This
That will be
really,
the
we
first
want to
sense of
emphasize
competence.
that just
For
because
fight-
you've done the testing,
Yeah,
do not follow the precautions.
that is the only thing which I want to make it, that by doing a testing, you are doing a psychologically satisfied that I have done the test and all that. And legally also there is no
And
condition.
research was. So finally, we have to say, if we get corona, so what? So this thing is so what?
Yeah, I agree. I endorse.
So what?
Narendra, I endorse. Thank you very much. Thank you very much. It's a debate. It's a debatable thing. Time will test. We are still in the learning curve. And I think at the end of 2 to 3 months, when everything will be normalized, then we'll say that, yes, we are unnecessarily worried about corona. Thank you
We
very much.
didn't contact Corona, but we contacted PC after a long time, which is a very good thing. So we are very happy. Thank you. Thank you very much.
Thank you, madam.
Namaste.
Thank you very much.
Thank you, everyone.
Thank you.
Yes,
very much.
Mr. Balaji.
Thank you,
We'll
sir.
end it.
I thank every one of you for giving your valuable time, because you spontaneously, you people agreed for today's session. It is my great pleasure, and Shield is honored to have all of you in the Shield Connect. As Anirudh sir was telling, we will bring in a lot of positive connect with our Shield Connect, and we need all your supports to make this Shield Connect as a very successful initiative. Thank you very much, Doctor.
Thank you. Thank you.
Thank
Thank
you.
you. Thank you.
Namaste.
Thank you.